Suicide, a word that many of us are familiar with, but most of us feel very uncomfortable openly discussing. In September of 2025, the World Health Organization reported that 727,000 people died by suicide in 2021 throughout the world. This is the population size of Seattle, Washington. Seattle, Washington is the 18th largest city in the United States, so let that sink in for a minute. We preach about bringing awareness to suicidal ideation, but equally important, we need competent and confident mental health professionals who are direct and adequately trained to work with diverse clientele experiencing suicidal ideation. For mental health professionals, there is the American Counseling Association, which has codes set in stone for this very topic. However, the reality is nothing is going to be black and white. The foundation of counseling is rooted in ACA Code A1A, which states that the priority of counseling is the welfare and safety of all clients. Openness and honesty around limits to confidentiality is another code that states that if there's harm to self or to others, it is mandated to be reported. However, beyond these guidelines, some barriers, challenges, and hindrances do occur and get in the way of clinicians' ability to assess the severity of suicidal ideation within a client's life. Suicide is not a one size fits all thing, it does not discriminate. It impacts every age, gender, religious denomination, family structure, and culture. The awareness around religious beliefs, faith foundations, and cultural stigmas is a must for counselors. Many religious communities and cultural groups criminalize suicidal ideation, which therefore makes it a lot more challenging for these individuals to seek help due to the stigma that's attached. When counselors know about potential religious traumas, barriers to open communication within these topics, and shame and guilt that come from suicidal ideation within these groups, counselors are then going to be better equipped to have interventional conversations that meet clients where they're at. Studies find that religion can be a protective factor and safeguard for some, but it can also be a risk factor for others. And this is a consideration that mental health professionals need to take into consideration when they do assessments. Mental health professionals face fears and malpractice claims, which then instills this better safe than sorry mindset. Sounds wonderful, except it can lead to an increase in overestimating risks and rehospitalizations, which can be more traumatic for clients. There can be this post hospitalization impact, such as clients feeling that they were more traumatized from going to the hospitals than if a safety plan was utilized as an interventional option. On the flip side, some professionals may underestimate the risk at hand, therefore jeopardizing the safety and well-being of the client. A few ways to increase competency within the mental health profession is through adequate and deep training, accessible support, and supervision. Consultation upon questions and concerns within this topic is something that all professionals should utilize, as well as clinical documentation, as this is essential for the decision-making process of that professional, especially when it comes to suicidal ideation assessments. Professionals must intentionally attend to their feelings and beliefs regarding suicidal ideations to offer the best quality and individualized care for every single client that they see. People deserve to be taken seriously. They should be approached with confidence and genuine care because individuals deserve ethical and competent quality counseling care. Thank you.